Ferguson, Senior Editor for GEMS. We're here at EMS Today 2018 in Charlotte, North Carolina. And today I'm joined by Dr. Marc Eckstein, Medical Director for the Los Angeles Fire Department. Dr. Eckstein was awarded the EMS10 for 2017. He's one of our innovators in EMS. And today we're going to talk to him a bit about his innovation. So, Dr. Eckstein, tell us a bit about the work that you've been doing in Los Angeles.
Well, I'm very fortunate to have a great team to work with and a very proactive fire chief. And our elected leaders in the city have been very supportive. We're the second busiest EMS provider in the country. So the focus has been trying to provide expert care for the ill and injured for over 100 years to 4 million plus people. And like most EMS providers, our call load has gone up considerably to a point where it's unsustainable. And it's interesting when we drill down and look at the data, the bulk of the increase in our EMS call load is not the high acuity patients, it's actually the low acuity patients. So we're a fire-based EMS operation. Just about all our providers are firefighters and EMTs or firefighter paramedics. So they're expert at going into the IDLH and resuscitating the acutely ill or severely injured patients. However, now what we're seeing is a greater and greater percentage of patients who are relying on 911 to take care of their chronic medical issues, their social issues, substance abuse issues, mental health issues, for which our people really aren't trained for. And then beyond that, the state doesn't allow our paramedics to transport patients anywhere other than an emergency department. And we know, I can tell you as an emergency physician, there's not much we can do for patients in mental health crisis or fighting chronic substance abuse. We perform medical clearance, we rule out life threats, and then it's the proverbial kicking the can down the road where these patients are basically released and we see the recidivism and they come back over and over and over again. Mm-hmm. So they're consuming a huge number of EMS resources. It's a real adverse impact on morale for our members because they can't help these people. They see these individuals day in, day out. These are the vulnerable adults in our society. So given all that, we embarked on some major changes. So we started an EMS bureau in the fire department. Approximately 90% of our emergency workload now in LA has a medical component. Mm-hmm. So we have a dedicated Bureau of EMS for which I command. We started a public health unit, which is our public mobile integrated health unit. We call it public health unit to get people a little more akin to what that entails. And we created an advanced provider response unit. So we started hiring what we call EMS advanced providers, and these are nurse practitioners or physician assistants, and we partner them with an experienced firefighter paramedic. We put them on an ambulance that has a lot of additional bells and whistles on it. So the paramedic, they bring their street knowledge and their expertise in ACLS and acute resuscitation and operational skills with an advanced provider who has many years of medical training, who's expert in urgent care and chronic illness treatment. And they have several missions. So they go on, they're dispatched on low acuity patients, and they can treat and release. So they have a lot of diagnostic tools. They have point of care testing for electrolytes. We field tested point of care ultrasound. They could do wound repair with basic suturing. They can give vaccinations. They have a slew of medications. If someone needs an antibiotic, they'll give them not just their first dose there, but give them their next dose before they get to a pharmacy. They carry medications that paramedics are not allowed to carry in the state regs in terms of different analgesics. So they have a very, very wide scope of practice. The idea is treat and release and not tie up our scarce resources taking low acuity patients to the already overcrowded emergency departments. The other mission they have is to medically clear patients with mental health crises, which is really expanding exponentially in terms of the call load. Last year, we responded on about 15,000 mental health emergencies. And again, paramedics cannot do very much but transport these patients to an emergency department, and the patients aren't getting the care they need. So the Advanced Provider Response Unit team, they perform medical clearance. They may provide some medication to the patients in the field if they're in mental health crisis or they're manic to de-escalate them. And then if they're medically cleared, rather than transporting them to an emergency department, they'll take them to a psychiatric urgent care facility where the ambulance, the APRU is back in service in 10 minutes. And more importantly, these patients in mental health crisis see a mental health professional within 20 minutes, which is truly remarkable. We compare the groups that our paramedics transport to emergency departments, and the mean period of time they wait to see a mental health professional is over 24 hours. So that's huge. The other element of patients they're working on is the chronic and public inebriates, patients who are battling chronic alcoholism, which tend to result in 911 transports many, many times. They comprise a high percent of our EMS super users. So again, the Advanced Provider Response Unit responds to public inebriates, many of whom are serial inebriates. Again, they perform medical clearance, and then rather than transport these patients to the emergency department, they take them to a sobering center where they're in a monitored setting to get sober and try to get them into detox and transitional housing. And the other component, the last part of their mission, is to go proactively on our EMS super user. So we have a pretty robust database of our most frequent EMS users, the so-called Platinum Club frequent flyers. Some of these individuals call EMS hundreds of times per year. And again, it consumes an inordinate amount of resources, ties up already overcrowded emergency departments. Our paramedics are holding the wall trying to offload these patients. And it's just, particularly this year we had such a severe flu, it's really compounded a crisis. So we have the Advanced Provider Response Unit make a home visit with the EMS super users, and they do a basic needs assessment, and then they have a social worker respond within the next 24 hours to do a real comprehensive needs assessment to try to help get these vulnerable adults, to help them navigate through the healthcare system, get them assigned to a medical home to address their chronic medical issues, try to get them counseling for substance abuse, mental health issues, and try to just break their reliance on the 911 system for all their daily issues. So we're really excited about this program. We also have a dedicated sober unit now, which has a singular mission to respond to the public inebriates, perform medical clearance, take them to the sobering center. And that's staffed with one of our firefighter paramedics, a nurse practitioner, and a case manager who's expert at establishing rapport with the public inebriates, most of whom are homeless. And they have to build that trust to be willing to go voluntarily to the sobering center. We're in the process of putting about 6 to 8 additional APRUs out in the field over the next few months. So we're really excited about that. And basically, we're just trying to now, as the demands for 911 in Los Angeles are changing, we're trying to better match the service we provide with those demands, because there's nothing worse than when you hear of someone who truly needs paramedics where they have a time-critical, life-threatening emergency. The paramedics aren't available because they're going on a low acuity patient or a mental health patient or a serial inebriate, and that's really the insult to the injury. So we're trying to better match the service we provide and whom we send with the changing needs of the patient population.
Well, this is just an incredible achievement that you have done in Los Angeles, and I really thank you so much for taking the time to talk with me today, and congratulations again for being one of our EMS10 for 2017.
Thank you so much for having me. It's quite an honor. Thank you.
Thank you.